Welcome to Health Management Academy and the ED process video. Today, we'll be talking about ED processes to decrease the number of ED patients who leave prior to seeing a physician or leave against medical advice.
Hello, I'm Dorothy Ann Mayer, the Chief Nursing Officer here at Sebastian River Medical Center. Effective mechanisms for emergency department crowding and delays in treatment have become major priorities for U.S. hospitals. For health management, effective ED management and patient flow are major priorities for clinical institutions today and going forward. An extensive literature search was completed, including IHI best practices at such facilities as Baptist Medical Center in Memphis, New York Presbyterian Hospital, and Grady Health System in Atlanta, to name a few. The Patient Flow Scorecard was developed in 2009. 3 components, input, throughput, and output, were used to establish a process outcome model with national and internal benchmarks. I want to briefly review the input, throughput, output model from which the scorecard was developed. Input includes the physician practice, availability of services, perception of quality, and relationship with EMS. Throughput includes several facets: registration at the desk or at the bedside, fast-track model for less acute patients cared for by our mid-level providers, diagnostics, radiology, and lab experts implementing and evaluating best practices for quality and efficiency, and assessment triage to primary nurse assessment and door to MD exam. Output includes all this: effective resource management program consisting of skilled care, home care, and transport services, bed control person with accountability for metrics of assigned beds, a minimum of 2 bed huddles per day, a priority list for patient assignment, and effective environmental service tracking and communication. At Sebastian River, we have decreased our AMA LWAT rate by over 60%. It's not just an emergency department measure. It has taken every department thinking out of the box to improve their measures. Nursing, we have the nurse, the charge nurse, the physician, and the supervisor all speak to the patient contemplating AMA LWAT. We solve their issues. Lab, physically moved an analyzer so their lab person could improve their flow instead of walking to different counters in the lab. This improved their score from 94 to 97%. Lab also has a flat screen for their soft lab, showing patients waiting to be drawn, changing colors to red on screen as the time goes by. Radiology has a screen that crops the emergency department stats to the top of the page, improving their throughput. Our floors accept admitted patients from the emergency department within 30 minutes. It takes engagement of every department here at Sebastian. While we've made progress, there are still opportunities. This video will focus on strategies to reduce AMA LWAT, assess patients within 20 minutes, assign beds within 30 minutes, and get inpatients to their assigned units within 3 hours.
That's a lot to cover, so we better get started. Ready?
Hi, can I help you today?
I hope so. I have a skin infection on my arm,
Okay.
and I think maybe I have an abscess. Can somebody look at it?
Okay, so let's get you signed in and then we'll get the nurses to take a look at you.
Okay, good.
It's early in the morning. There are some empty rooms. The triage room would not typically be utilized. The registration staff would call the triage nurse, who would immediately bring this patient to a room. This is known as pull till full. Bedside triage and registration is a powerful tool to decrease overall length of stay and increase patient satisfaction.
Hi, can I help you today?
Oh, yeah.
Are you okay?
I'm just not feeling well.
You feel like you're going to be sick?
Yes, I do.
Okay, here.
Oh, thank you.
There
Thank
you
you.
go.
Thank you.
Okay, let me get your last name in the system.
Sure. It's Quevedo. Q-U-E V-E-D-O.
Okay, and your first name?
Ivan. I-V-A-N.
Okay, and your social?
444 68 2413.
Okay. And your date of birth.
9/5/58.
Okay, and I'm going to have you sign. This is your permission to be treated.
Okay.
You can sign on the yellow.
All right.
And do you have a medical living will?
Yes, I do.
Okay. Since you have one, you can initial here that you don't need any information and sign on the yellow for me, okay?
Okay.
Okay, and I have you in the system. We're just waiting for the nurse to come out and pick you up, okay?
All right, thank you.
You're welcome.
It is important we properly identify patients by their existing medical record number. This provides us with instant information such as their medications, allergies, and pertinent medical history.
Mr. Quevedo, my name is Kathy. I'm the triage nurse. All the rooms in the back are full right now, but I'm going to start your assessment up front here if you'll come with me.
Okay, thank you.
Right this way. Mr. Quevedo, can you tell me what's going on with you today?
Oh, I don't know, about 4 hours ago, I just woke up from a nap and I'm sorry. I just started vomiting and it was just bad. So I came in.
Any diarrhea?
No.
Can you give me a number for your pain? 0 to 10? 10 being the
Oh,
worst?
it's like a 12.
Okay. And it started 4 hours ago?
About 4, yeah. What time is it?
Okay. Right now it's 3:20.
Yeah, it was about 11.
And the pain began suddenly?
Just all of a sudden.
Okay. Did you try eating at all?
No.
Have you noticed any blood in your stool?
No.
Okay. Do you have a regular medical doctor?
Yes. I just got a new one. Chavez, yes.
Okay.
The female.
The female?
Yeah.
All right. Any other complaints at this time?
Just the pain.
Okay. Your blood pressure's a little bit high right now. I'm going to take your temperature. You hold this under your tongue, please.
Okay.
Okay, almost done. Don't vomit. Almost.
Okay.
It's going to have to start again. Okay, there we go. No fever. Okay. Do you have any allergies to medications that you're aware of?
No, I don't really take much.
Okay, do you have a list of the medicines with you?
Not on me. I take aspirin.
You take a regular aspirin or baby aspirin?
No, I take the 81 milligrams. I
Okay,
take
that's
2 of
good.
those every morning. And then a vitamin.
Okay,
And that's about it. Yeah.
Okay. Any medical problems that you're aware of?
No, no, nothing.
You okay?
Yeah, I'm fine.
How much do you weigh?
About 280.
Anybody come with you today?
No.
Okay, as soon as I get this typed up right now, there are no rooms in the back. We're quite busy today.
Okay.
But I'm going to draw some blood and give you a container to give me some urine specimen. And we'll keep you out in the waiting room until a bed becomes available. Okay? We'll check on you periodically. If anything changes within that period of time, either get the girls at the desk to call me. Okay? And we'll come out and take care of you.
Will it be long?
Hopefully not. It shouldn't be long. We're going to get you started in here so when the physician gets to you, your workup will already be in progress.
Oh, okay, good. Thank you.
Remember, thorough, accurate assessment is key to test mapping and accurate intervention.
Mr. Quevedo, we're going to process that blood work now. I'm going to ask you to give me a urine specimen. There's a bathroom in the lobby. Right now there are no rooms in the main ER, so we're going to have you sit out there. I'll keep checking on you. If any of your symptoms change, if the girls up front are hollering, they'll come and get me. Okay?
All right.
Okay. Do you need help getting up?
Please.
Okay.
When the nurse completes triage and an open room is available, the patient should be immediately placed in the room and readied for the physical exam. If there are no open rooms, the triage nurse will monitor the patient and comment their 30-minute rounding in our electronic documentation system. The system prompts for 5 key points of rounding. These 5 points are used for patients being rounded in the waiting room and also in the patient room. If in the waiting room, the call light question is marked non-applicable. Was the pain level assessed? Was the patient educated on the call light, and is it within the reach? Was the family or patient updated on the plan of care? Was the patient or family notified of pending items? Was the patient informed when you would return? The benchmark for placing the patient in a room and initiating the primary assessment is 15 minutes or less from arrival time, although the scorecard says 20 minutes. If there are excessive delays and the patient approaches registration with statements about leaving, the registration staff needs to contact the triage or charge nurse. Have a nurse speak with the patient, someone who can encourage the patient to stay and complete treatment. The nurse would expedite room assignment to discourage the patient from leaving LWAT. To ensure the emergency department patient visit flows smoothly, all ancillary services like lab and imaging services play a significant role in this success. As you notice, the triage nurse obtained the urine specimen and necessary labs on the patient. It is also very important to note that all labeling of the lab work, including blood work and urine specimens, should be labeled while with the patient to prevent errors.
Come on into your room here, Mr. Quavito, and have a seat on the stretcher for me, sir. I need you to go ahead and take everything off except your underwear. The opening goes in the back, okay? I'm going to go out and close the door and give you some privacy, and I'll be back in a few minutes to check on you, okay?
All right.
All right, sir. Mr. Quavito, I have a blanket for you to make you more comfortable. Are you comfortable lying that flat, or do you need me to lift your head up some, sir?
Oh, a little up, please.
Absolutely. You tell me when you're comfortable.
That's good. Yeah.
I'm going to give you your call light right now, sir, so that if there's anything you need, you can get a hold of me. The red nurse button right here is anything you need at any time, okay?
Okay.
Now I need to do my physical assessment on you. Can you sit forward for me so I can listen to your lungs? I'll take that bucket for you.
At this point, the primary nurse is performing her clinical physical assessment. This is a valuable part of the process. The nurse tailors the exam to cover the patient's specific chief complaint. This information is recorded in the electronic charting system. The nurse would communicate pertinent findings with the ED physician. If the physician is available, he or she should meet the patient in the room with the primary nurse. This would allow them to ask questions at the same time to reduce the number of repeated questions.
Mr. Quavito, I'm Dr. Davidson.
Hi.
I understand from the nurse's note you've got some abdominal pain and nausea, and you vomited a few times.
More than a few.
I'm so sorry. I'm concerned about your pain, so I'm going to order some pain medicine and
Please.
anti-nausea medicine right away.
Good, good.
Yes, Dr. Davidson.
I'm also going to order some tests, and as soon as I get everything back, I'll give your doctor a call, and she and I will decide together whether you'll be able to go home today or you'll need to stay in the hospital.
All right. That's fine.
You got a great team taking care of you today, and we want you to be okay. If you have any questions or any more pain, please let me or your nurse know.
Just the pain and the nausea.
Okay. We'll get that taken care of shortly. Do you have any other questions about anything?
Nothing right now.
Okay. Thank you.
Okay.
I'm going to go ahead and get your pain medicine, Mr. Quavito, and we'll be back with some fluids in just a few minutes, okay? If there's anything you need, you let me know, or I'll be back in about 30 minutes to check on you, okay?
All right, thanks.
Yes.
It is important to explain the process for the visit and how long it is expected to take. When patients understand delays, they are less fearful and often rate the visit on a more positive note. They are also less likely to sign out against medical advice when they are kept informed.
Hi, can I help you?
Sure. I've had a sinus infection for like 2 weeks and I just can't get rid of it.
Have you been here before?
Yes, but it's been quite a while.
Do you happen to have a med key card?
Yes, I do.
Okay, I'll get that and pull your account up. Meanwhile, I'll need you to sign the consent form. And your name is?
K-I-R-K. First name is Robert.
Middle initial, if you have one.
A.
Okay. I need you just to sign that for me, please, and I'll pull your account up so we can verify some information. All right, what we'll need to do is verify your date of birth.
It's February 21st, 1950.
Okay. And your phone number, home phone number.
It's 772-589-1940.
Okay. Okay, let's go with. This is Jolene, and she's going to take care of you. And I'll give you, let you have this back, and you can go with Jolene, okay? Take this with you if you will. Complete that and give it to the triage nurse.
Okay.
Okay?
Mr. Kirk, right this way. We'll take you to the triage area.
Let's pick up where we left off with patient 2. His lab results just came back.
Oh, hey, Lisa. I looked at the results on Mr. Quavito's lab tests, and I talked to his doctor. Could you go in with me to the room so we can discuss our plan with him?
Yes, ma'am.
Okay. Mr. Quavito, I've got your test results back, and they show you have some dehydration and may have an infection. I've talked to your doctor, and she and I both agree that it'd be best if you stayed overnight for observation.
No.
I understand you don't want to stay, but I'm worried that if you go home, your pain may get worse.
No, I can't stay right now. No, it's no.
What if we get your CAT scan ordered so we can further evaluate your pain? And then I'll give your doctor a call back, and we'll see how things are going.
All right, we could do the test, but I can't stay right now.
Okay. All right.
All right, Dr. Davidson, I'll take care of those CAT scan orders and I'll get that done right away. Mr. Quavito, are you having any more pain? Can I get you anything else to make you comfortable right now?
It's eased up a lot, and the nausea is finally under control, so thank you. I'm okay right now.
Okay,
Thanks.
I'll be back to check on you shortly.
Okay, good.
Even before the radiologist reads the CT films, the ED physician can review the scans to determine if admission is likely.
This is Mr. Quavito's CT. He's definitely going to need to stay in the hospital.
Well, I'll go ahead and get hold of the resource manager for you right now, Dr. Davidson. Take care of that.
Thanks.
We already know that the patient is adverse to admission. Now that the ED physician has seen the scan and knows that admission is likely, the nurse can begin conversations with the patient about potential admission.
So what can I do to help you today, Mr. Quavito? What is it that I can do to make you stay in the hospital so you can get the treatment that you need this evening?
It's my dog. There's no one, you know.
There's no friends or family that I might be able to call that we might be able to get them to take care of your pets for this evening till we can get you feeling better?
I have a neighbor.
Well, I'd be willing to take that number and call them so that we can get you admitted for the evening into observation status.
Thanks. Yeah, yeah, okay.
Okay, I'll take care of that and I'll get a hold of the resource manager and we'll get you admitted to the hospital.
Thank you.
Way to go, Lisa. You probably just prevented an AMA. Now, she can call the resource manager to confirm he qualifies for admission.
Hello, Anna. We have a patient down here in the emergency room who's going to be placed in observation status. Can you please come down and review the chart for me to make sure everything's in order?
Sure, I can come down there and take a look at that, and we'll see if it qualifies for inpatient.
Thank you.
Hey, Lisa.
Hi, Anna. How are you?
I'm good. How are you?
I'm doing good.
I came down to look at Mr. Quavito. Tell me what you know about him so far.
Well, so far his white count is elevated as well as his amylase and lipase. He's received numerous pain medication injections as well as antiemetics so far.
Okay. We don't have quite enough to qualify him as inpatient, but what I'd like to do is call Dr. Atkins, our physician advisor, and run it by him. I think he can help us.
Okay. And you'll give me a call back and let me know what to do from there?
I sure will.
Okay, thank you, Anna.
You're welcome.
Hello?
Hello, Dr. Atkins? It's Anna.
Hi, Anna.
It's down here in the emergency room, and I was hoping you could help me with a case. Dr. Davidson admitted a patient to observation, but it looks like there might be more going on. In looking at what's in the record, his white count is up a little bit, so is his amylase and lipase. CAT scan's not back yet, but the patient has a lot of pain, and we've already given him 2 doses of Dilaudid. I was hoping you might be able to take a look at this for me.
Oh, based on what you're telling me, it sounds like we have an opportunity to query, and this patient will require inpatient admission. I'll give Dr. Davidson a call and go over the further clinical information with her as far as comorbidities, and we'll move forward. I'll fax you a copy of the form, and we'll move forward.
Thanks a lot, Dr. Atkins.
You're very welcome.
Wow, so many pieces, or rather services, to meet the needs of the patient in the emergency department. The physician, nurse, lab and imaging services, admitting physician, and possibly surgical services. It is a team effort. The success of each team or service is dependent on the ability to complete each segment timely and efficiently. Now that the patient is being admitted, let's see what other players or team members become involved for a smooth transition of the patient from the emergency room to the inpatient unit.
It's been really steady, but other than that, we've been fine.
Okay, hold on, I got a phone call.
Oh,
Sounds
okay.
like.
Go ahead.
Hello?
Hi, this is Sherry in the emergency department. I have confirmed orders and I need a male bed, please.
All right. Okay. Alrighty. Okay, I'm going to write this down and I'll give you a call back with a room in a couple moments. Okay, bye.
Okay.
Pally, it looks like I got a patient for you for med-surg from the ED.
Okay.
All right, it's a 52-year-old male
Okay.
who's being admitted with abdominal pain.
And the doctors?
It's Dr. Iwanski. And what room would you like to place the gentleman in?
Well, is he confused or?
No.
Okay. We can put him in 207 then. And
Okay.
it's going to go to Tampson.
All right.
She'll be at 7981.
Okay, great. Let me call the ER back. Okay, thanks, Polly. ER registration, this is Monica. May I help you? Yeah, this is Colleen, the supervisor. Yes, the patient can be placed in room 207, and Tamsin will be the nurse, and she can take report at 7981. Okay, thank you very much.
The process is running pretty smoothly. Again, timing is everything, and facilities should be measuring how quickly they receive the room assignment when called for a bed. This time span should not exceed 10 minutes. With every department working together toward the goal of meeting the patient's needs, we should not fail. Remember, they are the reason we are here. In summary, these are metrics you are familiar with. The processes and outcomes have been demonstrated here and are being reported on the patient safety and patient flow scorecards. Time of presentation to ED to primary assessment, less than 20 minutes. Average wait for the room, less than 30 minutes. Rounding in the waiting room. Mean door to MD exam. AMA prevention. LWAT prevention. Radiology turnaround time. Lab turnaround time. Rounding in the ED. Time from ED presentation to discharge, less than 2 hours. Less than 2 hours, green. 2.5 hours, yellow. Greater than 2.5 hours, red. Patient triaged, assessed, evaluated, and assigned bed, less than 3 hours. Designated bed control person met established metrics for bed assignment and placement.
The key to success in emergency department management and bed flow is communication and accountability from all disciplines of the healthcare team. Measurement of process and outcomes will continue to be the monthly patient safety and patient flow scorecards.
You have seen an example of a highly reliable organization effectively meeting the processes and outcomes for effective patient flow. It takes all of us working hard and together to achieve these outcomes.